Rett syndrome is a severe neurological disorder that affects only females. It robs a normal functioning toddler of her abilities to speak, use her hands, and communicate. Well, Dr. Deborah Hendrickson is a pediatrician with Northern Nevada Pediatrics. First off, thank you so much.
My pleasure. Thank you.
Yeah, thanks for being with us. So Rett is sometimes misdiagnosed as autism or cerebral palsy. Why is that?
The symptoms initially are very similar.
Okay.
So the girls seem pretty normal up to about 6 to 18 months of age, and then suddenly begin to deteriorate fairly significantly. If they had some words, they will suddenly lose the ability to say those words. If they were walking a little bit, they might lose the ability to walk or start walking in a very unusual way, and they lose the purposeful use of their hands, like you said. But the part that mimics autism is they often make poor eye contact, and they show some social impairment. And because of that and the language loss, people will often misdiagnose it as autism.
So if you have an autistic child and you're seeing some of these other symptoms show up, is there a specific test for Rett?
There is. It's a genetic test. Okay. Most of the girls who have it have a defect in a gene called the MECP2 gene, so we can do a genetic test for it.
And is there any known cause of Rett syndrome?
That's the cause. It's a spontaneous genetic mutation. It's not inherited from the parents. These girls just, for some reason, something went wrong, and this gene mutated, and they end up with the disease.
So then what is the treatment protocol for someone with Rett?
Yeah, at the moment there is no known treatment. There are a bunch of clinical trials going on. I have a patient who's in a clinical trial at Harvard, at Boston Children's Hospital, so there's some hope that there'll be some treatments. But right now it's just supportive care, and these girls are very disabled by the age of 3, so they need a lot of help and care from their families. But beyond that, physical therapy, things like that can help a little bit, but there's no cure.
So these clinical trials are looking at drugs that might do something in the body to try and not reverse it, but
maybe reduce the symptoms somewhat. Yeah, especially this. The biggest symptom these girls suffer with is what's called apraxia. They have a lot of trouble with motor movements. Okay. They have these classic hand wringing symptoms they do. They can't control, reaching out and trying to use their hands or their body in any way. And that's why it's sometimes mistaken for cerebral palsy also. Okay. But the drugs are usually looking at to try to reduce those symptoms for them.
Okay, Dr. Hendrickson, thanks so much. We certainly appreciate your time. She'll be taking your calls on general pediatrics as well. All you have to do is dial 858-2222.